Hello, I'm Tim Murray. I'm Chief Executive Officer of Aware Senior Care, and this is my wife, Gina.
And I'm the director and also an RN.
We thought we'd share, we're going to be meeting with all of you shortly, as it's been a privilege to be selected as a new home care provider there at Abbotswood. And we thought we'd just give you a little bit of background about us, just our philosophies, and then some more information so we can start that process. So I'm going to share my screen. We have a little brief presentation.
We would have done this in person, but unfortunately COVID is preventing that. So
we thought we'd do it virtually to get to know us. But like I said, we're going to give you a little bit about Aware. Gina will kick it off and talk about how we got started in 2014 to understand us and our philosophies in home care, and then talk about the transition period and what to expect from us in the coming weeks. And then a little bit about managing the care. I think this is very important. That the good news is we have a system we call CINCH that my wife named. It's actually our own proprietary developed iPad-based, cloud-based software. We can track visits, and I'll show you a little preview. And then how to contact us. So I'll turn it over to Gina.
So Tim and I started Aware Senior Care in 2014. And it was based off experiences we had finding care for our own family members. I've been a registered nurse for a very long time, and Tim ran a worldwide software company. And 6 years ago, we took the leap of faith and decided that this is what we needed to do. So we are privately owned. It's our company. Tim served in the submarine force. And we provide personal care, companion care, and we also have nursing services on our license. We have well over 120 caregivers, 9 full-time staff members in our office to support them. We truly are committed to providing exceptional care. You will find that we will respond very promptly to all communications, and that's negative or positive. We can't fix what we don't know. So we really want your feedback, and we are dedicated to serving our precious seniors. That's our mission for our agency.
Well, the two of us will kind of tag team on the transition of services to Aware, but the process is already starting. Today, David should be communicating to all of you about the changes, and we will share information, and we're going to do a lot of things electronically. Especially with COVID, we've got to learn to be able to do things, and so we've got a very efficient process to get you informational documents. And during the process, 2 key things: all residents that would like our services will need to have an assessment by the nursing staff, and Gina and Carrie, and sign what we call a service agreement. And it's probably similarly what you experience with nurse care, to provide services, your rights, and so on and so forth, and the pricing for those services. The care plans drive the schedule and the visits, and a little bit more about this to come. We will develop the care plans. We'll work together. We'll review what was going on, so we make sure we completely understand. We've got a lot of that information already. That's the good news. And then we're going to make sure what we're doing is the right thing. And we've got a plan that you're very happy with. And then we sign it, and then we'll be ready to go. In terms of the when, the Aware staff will assume, we're going to assume management of the client schedules from nurse care on July 6th. In essence, they'll contract to us to organize and run the show, with the official transition totally to Aware Senior Care, and our flag is raised above the property on July 25th. But we've already started the process. And during that transition time, the residents will continue to pay nurse care for the visits prior to the transition.
Right, and we're going to be looking at the teams, the aides that are currently working there, and seeing who's going to transition with us. Nurse care is allowing that to happen. And we have actually been staffing part of the building with nurse care. So we have aides that you're probably already familiar with working in the building that want to stay there.
So it's really best of both worlds in this transition, and nurse care has been very gracious to work with us in that regard. So in terms of managing our care services, I think there's some really good news here, because sometimes it's difficult to understand when a caregiver was with your loved one or in your apartment, what was done. Our services and the way we're priced, it's very simple to understand. it's all based on the length of a visit. Visits can be very short. They can be 7 minutes, like a quick wellness check, 15 minutes, 30 minutes, 45 minutes, and then we can have extended hours. So it's all based on time. And how much time it takes? Well, each visit will have a specific task list based on your requests and needs. So nursing sits down, forms the care plan, and we look at, well, I want an escort, or I need a medication reminder, a shower, and so forth. You add these things up, we know how much time these things take, or caregivers should take.
And it'll be a process. We give our best estimate, and we know during this transition period, it's going to change. Because it also depends on the ability of the resident to function. Some people can take a shower in 30 minutes and others need 45. So it's really individually based. And we will work, it's going to be a work in progress till we get it to just the way you want it.
And we can monitor it, make sure it's working. And I concur with Gina's saying, one thing, change happens all the time. Tasks can be updated anytime. That's the good news. We can update this plan anytime based on your feedback. And we'll manage and record the visits using our cloud-based application we call CINCH. We've moved away from paper a long time ago, and I think you'll be pleased where this is actual system that we developed over the last couple of years, because managing home care in a community is really different than a home environment. And you're seeing the actual screen of an iPad, a little electronic tablet, and a caregiver has a little handheld and will come to your apartment and start the visit. It's like start the clock. And you can see this is Shatika. She's one of our actual caregivers. And the tasks that she performs during this visit from 10 to 10:30 are listed there. You see bathing, assist with shower, dressing and grooming, apply compression hose, household tasks, toileting. Each one is done. We'll click on it to show complete, or if it's incomplete, there has to be a note on why it didn't occur. So it's very detailed, and at the end of the visit, you see there's actually an electronic signature. So all the tasks before this can be signed either have to be completed or incomplete with a reason. The caregiver and the client, or the client gives us permission to sign, signs at the bottom, and the visit is completed.
Right.
And we have, so for those questions like, hey, when did mom has a visit, or I can't remember happened to visit, we have detailed records of when and who and what. And that's really handy. All of billing is based on this. So it's going to make what maybe was a little bit of work before, we've really done this, and we have a great management system and it's all electronic.
And it can be updated from any place. If you call in and say, I need to make a change for the next 2 weeks because mom has new compression hose that she has to wear, we can do that immediately in real time, and it goes right to the caregiver's iPad.
So we've really found the whole purpose was we wanted sufficient so we can focus on the most important thing, and that's care and providing great care. And we really had a lot of success with it. So in terms of contact, I think it's very simple. 919-436-1871. We're 24/7. That phone is answered. Now, the other good news is we will have what we call a community care coordinator. It is our lead person at the community, and they'll be there 7 days a week from 7 to 5. And will actually be in the office there above David's on the second floor. And this is a person that is responsible for care at the building and coordinating the caregivers. So they think of them as the leader, and they will know you. They responsible to know the residents, interface with David and Emily and the entire staff, and kind of run the show, besides being able to call the numbers. So communication is so key to really having great relationships.
And this person will also make sure those critical morning hours are covered. So it's also somebody who can take an assignment on the floor if somebody doesn't show up or somebody becomes ill. She can also watch to make sure the visits are being completed on time. So she may not be in that office too much, or hope she's going to be out and about and around the community. That's the goal, to get to know all the residents, the staff of Abbotswood, and the family members.
But very, very visible, and it kind of takes out of play. Well, who do I call, or who's the person in charge? It's the community care coordinator. And of course, we're all here to support that person, nursing and so on and so forth. But They're kind of the in charge. And for informational things like billing, non-urgent things, we've created a convenient email group called Abbotswood@awareseniorcare.com. You can email that, and we have a really great system. One of us takes it and says, "I've got this." And so we follow up. Just a convenient way for you to communicate, again, non-urgent issues.
Right.
So with that, we thought you'd just give a glimpse, and this is a very personal business. We feel so blessed to have the opportunity, been selected by David and the staff. It's a great, great community, and we really look forward to working with you, being your partner and your trusted partner in care there at Abbotswood.
We know that transition is hard and probably hardest on the residents, and we'll be very, very mindful of that. We look forward to getting started. We'll be up there starting today, which is Monday the 22nd.
Right.
And we appreciate it. We look forward to meeting each of you and to really getting to know, become part of the Abbotswood family.
Thank you, and we'll see you soon. Bye-bye.